Good morning, Mr. Mohan. Welcome to the webinar.
A very good morning. A very distinguished audience. I am Teni and my partner Siti Nur Fatima. Welcome to webinar Aquatic Therapy in Sport Rehabilitation. I have a few announcements before we begin today's program. To ensure the event goes smoothly, ladies and gentlemen are asked to turn off the microphone and open the camera, stay on the screens when the program begins. And I would like to remind all students and participants to scan the QR code display on the screen. Your cooperation is highly appreciated.
Good morning, Dr. Fariba.
Very good morning to everybody. Nice to see you.
Morning, Doctor.
Good morning. As a one good and new method in rehabilitation. Okay. Is there some VIP person here? No. Tamara is here. Good. Some of my master students are here. Tamara, welcome. And then all of you. I think my voice is clear for all of you.
Morning, Doctor.
Very clear.
Hello, you Arif. Ah, you are there.
Yes.
How are you, Arif?
Okay, Doctor, good.
Good. Okay, whenever you are ready, we can start. Today is your weekend. Maybe you wanted to go and rest, and then I just try to talk so effective, and then it's not too much confusing you, but it's, let's see how is going to our question and answer session. It's not COVID, don't worry. Arif, I'm ready whenever you mention. I can start. Is if you want to waiting for somebody, we can wait. If no, it's better to start because maybe a student join 15 minutes early.
For attendance, the program will shortly begin.
Can I start?
First of all, we would like to welcome Mr. Mohan Sundar Sankarwal, the advisor of Rehab Club, University Pendidikan Sultan Idris, and lastly, the lecturers of Health Science Department, Faculty of Sports Science and Coaching, University Pendidikan Sultan Idris.
Okay, before we start, let me introduce our speaker, Department of Health and qualification is Doctor of Philosophy in Sport Physiology, University Kebangsaan Malaysia. Hello, Doctor. How are you, Doctor?
Tenny, is it? I don't have your voice clearly. Should I start?
Wait, Doctor. How are you today, Doctor?
I'm fine, thank you. I'm so happy to see you all again, at least virtual world.
Okay, thank you, Doctor. The research of Dr. Fariba is more interest and rehabilitation.
Thank you so much. Very good morning to everybody and happy Ramadan to all Muslim in our panel. And then I hope Allah fill our life with the most brightness, health, and wellness during this holy months. And I'm grateful to share my expertise and knowledge via the UPSI Sport Rehabilitation Club. And I should say great thanks to Dr. I think they are not here, but definitely they are some people that is they support our rehab club. And if I think it's better to start now with sharing my screen. That let me share my screen without more wasting time.
Yes, Doctor.
Yes.
Yes, doctor.
Today I'm going to talk about aquatic trophy in sport rehabilitation. Definitely it is just an introduction and briefing about aquatic trophy, since the other area of science and knowledge in rehabilitation is too many expertise in practical and knowledge. It need to be in this area, but definitely it can open a very a good view to sport rehabilitation field. As an overview of today's webinar, we will talk about the basic information for aquatic trophy and definition, the terms, and then why aquatic trophy for rehabilitation purpose, and then what is the proper continue about aquatropy progression, and also some practical recommendation, just as a summary of program, exercise program, and also some example in the practical part in exercise for shoulder complex injury and exercise for lower limb injuries. Definitely, it's a fact that is when we talk about the story of this area, water is part of everyday life for our drink, cook, wash, play, and it covers all 70% of the earth, and then definitely the 60 to 70% of our body is water. Then water is vital, water is magical, and then but it is also play for the medical purpose. It shows in a that some picture and some evidence that is the Roman story is started from century of 19 in Germany first, that they apply hot and cold water in a method of therapeutic to boost immunity, to stimulate the circulatory of and nervous system, and then later it will develop and promote in a European sport that is still there is, they have a hot sport, and then variety of sport special in Germany that is common. And but officially as aquatropy is started in developed in 1987, is almost can be 30 years or a little more. That is we have a lot of expertise, we have a lot of publication, we had a lot of what you say, the branches of aquatic trophy to this slide shows, the picture shows the some hot spring and aquatropy in Malaysia close to the Tanjung Maling. I'm going to start, we should talk about the term of hydrotrophy, watertrophy, aquatropy. These days there is a lot of business area in many things that is in also in medicine and medical area and that field. Is meaning that sometimes we have hydrotrophy, sometimes to study sport rehabilitation And you should be familiar with these simple words and simple terms. And hydrotrophy is one of the eldest therapeutic methods for managing physical dysfunction. And then it will use painful scar and then arthritis, and then also to assist to through exercise. But mostly hydrotrophy applied in a hospital service and facilities is mostly, you can see, for example, in the some section of a hospital that is they mentioned that is hydrotrophy section or facility. Watertrophy is used for the effect of body tissue of heating, cooling, detoxing, and pain relief and relaxation of muscle. Is mostly related to drinking water. Is mostly, but is sometimes purpose some people also, but the specialists mostly. And aquatic therapy include any exercise environment, mostly at pool and in sport rehabilitation sports. And when they wanted to have some clinic that they wanted to just find a different name, that purpose is common. But the most thing that we need for sport rehab is aquatic or aquatropic. There is also another term in aquatropy and aquatic exercise that is as an alternative program for rehabilitation is depend on the purpose of we apply. For example, if the purpose is for injury prevention and then improving fitness, mostly with this common is water exercise program, aqua or water aerobic, deep water running, shallow water or walking exercise, deep or shallow water, aqua aerobic exercise, water-based exercise, aqua fitness, aqua yoga, aqua zumba, aqua cycling, aqua speeding, and a lot of new things also. Every year we can find out new also combination of to this aquatic exercise. But to achieve rehabilitation purpose, we mostly they use bathing and then hydrotrophy, aquatropy, aquatic trophy, and pool trophy or water trophy is also some common. And but as a sport rehabilitation student, need to know aquatic exercise is possible training method for athlete for recovery is meaning sometimes our athlete they have a high intensity training and then they need to recover very fast because they are going to be ready for the next competition. And the other is for rehabilitation purpose and also for stress release. And during game, they have a lot of tension, and then this also is another purpose that we use. And also aquatic exercise could be a method to work as aquatic therapy with the client who have compromised joint. It's meaning that is aquatic therapy is also not only for athletes, it's for all people that have some injury, and then after injury or surgery they want to recover faster. And aquatic exercise also can be used for both healthy and healthy, but they need to continue. I have some experience that when we during duration of the treatment is finished, the program, still they wanted to continue. Still is maybe some reason that is they find a good experience and they interested to still continue their program, treatment program or rehab program. And in this slide, I should talk about the goal and benefit of aquatic exercise for rehabilitation purpose. And when I mentioned the aquatic exercise, because it's mostly, as I mentioned, is the trophy is also can cover by it. It's the first thing that is reduced body fat, and then high, because the activity inside water, they need highly energy demands, and then reduce inflammation and faster recovery from surgery or injury, and also increase flexibility and range of motion, and provide relaxation, improve the cardiovascular stamina or fitness, reduce muscular tension, and also stimulate function and increase vital energy, and also some good benefit for during pregnancy, and also decrease chance of overheating and preventing it. And it's good to know then aquatic exercise or aquatic trophy for who is meaning that when we wanted to talk in sport rehabilitation area, we should know who is our client, who is our, for example, people to participate. People who need to improve fitness and health. And the first group, when we talk about athletes. Athletes for recovery, as mentioned, recovery after high intensity exercise, they need to do some aquatic exercise. And for rehabilitation, also after surgery or injury. And interestingly, for all the sport people, some aquatic exercise program or aquatropic. And for injured people and for the rehabilitation purpose and physiotherapy for any people that have some injury, and then for obese people. It's a good media to have some activity inside water, because the first thing that is psychological effect, and then they are not feeling their weight, and this is non-weight bearing, and then is another thing that is they can hidden their body inside water and then more comfortable to do activity inside water. And then for kids with special needs like autism spectrum syndrome, like ADHD children, and also for people who need psychotherapy, self-esteem, self-confidence, relaxation, and socialization, and also its affect too much in our sleep quality. You can see is meaning that it's like a chain that is maybe all of this part of our health is, affect to each other, and then we can improve during this kind of exercise and therapy. And finally, for old adult people that are more comfortable to be active inside the water. And as a whole, you can see is for everybody who wanted to improve their quality of life in any age. Also, you can see in 90 years, 100 years, also people, they can go and then be active and do some exercise inside water. And but what is the specific goals for rehabilitation purpose or for sport rehabilitation purpose? Is definitely facilitate range of motion, initiate resistance training, and facilitate weight-bearing activity, and then enhance delivery of manual techniques and provide three-dimension access to patient. Is meaning that is the best media and atmosphere for to improve sensory motor integration. Is reason that is the good atmosphere for autism people also these days. And it's reason that is nowadays many occupation therapists suggest to our autism children learn swimming and then be active inside water and facilitate cardiovascular fitness, and then initiate functional activity, and finally minimize risk of injury and re-injury during rehabilitation. And relaxation also another purpose that we can improve during sports rehabilitation therapies. As you can see, there is a lot of what we say that is a lot of services or a lot of goals that we can achieve during the sport aquatropy in sport rehabilitation. This slide is like just a review for us that we know that is what is the contributed factors that is happen for after injury among our athletes, and what is the factors that decline the physical function. The first thing that is happen after any injury, our athlete, they cannot to be active, they cannot to continue their activity. Every day they have training, heavy training, and then have a competition game, but after injury they should stop it. And what was happen? Definitely they gain weight and increase adiposity or body fat percentages. That this cause is affected to, first, we lose our endurance and cardiorespiratory function. And is meaning that is little by little is decreased, because sometimes our athletes need to rest for 2 months, 3 months, or 6 months if they have, for example, some surgery after ACL or something is much more. Their problem is they gain weight. And definitely when they gain weight and they increase the adiposity, their amount of skeletal muscle reduce, and then it will be lower. When the amount of skeletal muscle is lower, definitely our strength and power loss, and then definitely range of motion is lost. And that is reason that all of them will be a package to increase risk for impaired physical function and sport performance for our athlete. It's just that this slide just showing that is what was happened as a summary for our athlete, a simple way after surgery or after they are stopped their exercise. And now, why we talk about aquatic therapy and why aquatic therapy is faster rehabilitation way and with a less pain. That is, we continue for our today webinar with this section. I should say, why exercise in water? Because of physical properties of water, because of unique physical properties of water. That is static and dynamic properties. And that is make different media for our injured athletes. That is allowed to be valuable tool for in physical condition and physical therapy. That is a different media that allow to be active without with less pain, because now we are talking about the properties of water. What is the properties of water? Is temperature of water. You know, is we can have a different spectrum of the temperature of water. And buoyancy, and the other is viscosity and surface tension, and also hydrostatic pressure, and finally depth of immersion on weight bearing. Is reason that is we can have a variety of temperature, different depth of immersion also, based on our facility that we have. Let's first talk about the water temperature. In a sport rehabilitation, we will consider cool or warm water. Cool temperature water or warm temperature. In cool, we mostly consider 26 to 30 degrees Celsius, but it's some also there is some evidence they mention until 32, until 30 also, and this water media with this temperature recommended for the vigorous cardiovascular workout and for increased oxygen consumption and increased metabolism of the body and increased exercise efficiency, and for elite athletes. Mostly elite athletes, they prefer to do some activity in this temperature of water. But ideal for hydrotrophy, especially in a hospital purpose, and they will use the 30 to 35 degrees Celsius. That is recommended for promoting muscle relaxation, reduce pain sensitively, reduce muscle span, increase ease of joint mobility, and increase circulation, and then blood circulation, and then improve respiratory rate. But the best for prevent any heart related complication is 26 to 28 degrees Celsius. And in this slide also, I'm going to talk about what was happened, what is the effect of cool water or warm water. In this cool water, that is mostly we mention also cold water, because 20 degrees is cold for our body. We consider its vasoconstriction in preferably is decrease, and then decrease the heat loss and then forcing to blood centrally. Is meaning that is mostly our blood circulation is coming to in a center of our body, and then enhance venous return, and then it's resulted to increase stroke volume and decrease heart rate. I should say you inside water, the heart rate is reported in many researchers that is 17 to 20 beats per minute is lower than the similar intensity, a similar level of intensity level exercise that we are doing in a land. And then is sometimes is one reason that is people, they are too much, they can be too for a long time active inside water, and then sometimes people, they are going to, for example, also in ordinary activity in the water, they are going to half day be inside water. If you ask him, that is, they can be in a, for example, the land, they cannot be maybe more than 2 hours, 1 hour if the ordinary people. And finally, is increased exercise efficiency. The dosage, that duration that we can suggest for this cool water is 20 to 30 minutes if used for flexibility, strengthening exercise, and aerobic training. What about warm water that we can consider 31 to 38 degrees Celsius is, we should know the first important things that is in this water media with this temperature. Our clients should be immersed until only neck, not more. And then increase, it's resulted to cardiovascular demand and then cardiac output. And also is centralization of peripheral blood flow, that is by, the thermal stimulation that is happened during the warm water effect. And also is increased heart rate, and effort for body temperature balance is in this warm water is heart rate is increased, while our heart rate in cool water is decreased. And then increase respiratory and range of motion, and also for to know that we can the final is muscle relaxation. The duration that we suggest is mostly is 10 to 15 minutes if used for therapeutic and strengthening, relaxation, and gait training and stability. But definitely is when we're working with some clients that have an injury, we should monitor them, and then is the other, but 10 to 15 is minimum, and then maximum 50. And the other properties of water is buoyancy and immersion. What is buoyancy? Buoyancy is an upward force that works opposite to gravity. Is meaning that is counter force that support when submerged object against pull of gravity. I think everybody knows about Archimedes' principle that if an immersed body experience upward thrust equal to the volume of liquid displaced. Is, I think, we know from, the many years in a school, I think. And these properties of water assist motion toward the water surface. Is meaning when we going to floating inside water, our body should automatically coming on surface of water. But the other things is sense of weight loss is equal to amount of water that dissipated. It's depend on how is the level of submersion, and also is different level for male and female during to center of gravity. It's reason that is related to our anatomy of body. That is, we women have a much more body fat percentages, and then also that is our is affected to our buoyancy center, and then mostly we females are more comfortable to be immersion and floating inside water comparing to the male. And also it allows for ambulation and vigorous exercise with little impact and friction to reducing between articular surface. And in this slide, you can see simply about buoyancy and immersion. Okay, in this part you can see the depth of immersion and weight bearing. For example, when we going inside the water, we have a different depth that is in any pool or any, for example, we know that is how is the depth of, how much is the depth of water. And if you're going to immersion until anterior superior iliac supine, you're just feeling 50% of your weight. For example, if somebody is 100 kg, just feeling 50 kilogram. If you're going to submerge immersion in a xiphoid level, you're just feeling 25% of your weight. Is meaning that the guys with 100 kilograms just feeling 25 kilograms, that they are light inside water. And if you immersion until your neck level is only 10%. Is meaning that if you are more relaxed and comfortable inside water when we, floating inside water, especially supine floating or floating on back. And then in the other part picture, you can see that gravity is and gravity center and buoyancy center. In this is you can see the people are stable in this position, and then because of center of gravity and buoyancy on top of each other is one line, and is in a vertical position. In the horizontal or supine or prone floating position, again, you can see the center of gravity and buoyancy closer to each other to assist to people, to the person will be, stable inside the water. And finally, the third one is the center of gravity and center of buoyancy is a little apart further each other, but is reason that is our leg, the leg of this shape is sinking. And then, but it can show that is how we can, our body can be float when we find the buoyancy of center. Maybe it's interesting to share with you if you are swimmer or if you learn swimming, when we catch the time, that is our buoyancy center is so enjoyable. At least I have a lot of experience when my student learning swimming, or some people that is coming for, to the rehab, for example, for low back pain or some exercise rehabilitation. And then when they catch that they can floating inside water, they are so comfortable, and then they are so happy that, oh, I achieved it. It's meaning that is when these two centers find each other and then we, accompany each other and assist together. It's reason that now I think you can find some logic, that is how can be this water media can be, they can provide different services for us in a different immersion and different, type of, floating. And the other properties of water is hydrostatic pressure and viscosity. It's interesting to know the density of water is 700 to 800 times more than air. As well as, the honey is more density comparing to the air, to the water. Is meaning that is just imagine how much density of water is higher. And this density definitely provide much more, to spend a lot of energy inside water. It's a reason that is you are going inside water and then do some activity. When you're leaving, you're feeling that is so tired, but inside water you're never feeling, because you're never feeling your weight, because you are non-bearing weight. And then is meaning that is because of viscosity or density of water. And the other is hydrostatic pressure is help to return the blood to the heart and limb return. Is special if you are floating in a prone or supine floating in a horizontal position, and then is the easy to to blood return to our heart. Is meaning that is mostly when we do exercise on land, we are in a vertical and standing position or maximum sitting, and mostly we are in a standing, running, walking in a vertical position. But activity inside water is a horizontal. That you can see just our blood circulation direction is meaning that is how much is easier is happen. And the other is reduce effusion or allow to the exercise to injure extremely without increasing effusion in rehabilitation service. And also cardiovascular changes significantly. As I mentioned, there is decreased heart rate. Some reported into 17, some also researchers shows that is until also 20 beats per minute we reduce our heart rate comparing to the similar activity in the land. And finally, the viscosity and the hydrostatic pressure, it can increase the cardiovascular fitness, muscle strength, range of motion, and stability. I think it's no need to say you, because everybody are familiar with Pascal and Newton's third law, that is action and reaction is happen inside water. And action and reaction is happen included the pressure, the hydrostatic pressure of water, and viscosity added to activity inside water. And there is some evidence that is reported as aquatropy is a success, 99% is for weight loss. It's different issue if you wanted to know about the aquatic trophy or aquatic exercise, especially for weight loss, is meaning that is people they need to they will expend much more energy during the exercise inside water, and there is a lot of evidence that all these services was successful for obese people. And then is meaning that definitely it's work for our athlete who had injury and or surgery, and after that they are not active and then they gain weight, and then it's a good way to reduce our athlete weight faster and then in a shorter time. And the other is for chronic pain, like low back pain, some pain that is they have in knee, and but they don't know what is the reason. That is for many years is with them, especially for old adult, is common. And this another success is in a back pain, low back pain, and all back pains category. And also for fibromyalgia is very good, effective. That is there is some reported that Aquatropic is one of the successful. And I should say that is in this slide we are going to talk about the so simple and advice for as an aquatic technique for aquatic trophy. And I should say you, and when we design a program for purpose of progress of strengthening or be active in an assistive movement, we should know in an aquatic trophy that is if the exercise or the program can perform some exercise in a various position. Is meaning in supine position, in prone position, in side laying, in seated, in vertical, and also you can perform with some equipment like a step inside water, like a bicycle or spinning inside water, or treadmill. It's a lot of, you know, this you can perform in a different position of inside water. And the other thing you should consider when performing aquatic technique, you should know what is the type of injury, what is surgery. You should know about ACL or any, for example, shoulder frozen or tennis elbow, any problem that is, or they suffering from that pain or injury. And definitely you need to follow the protocol of treatments based on the medical team suggestion. And you should know that the result, and always you should monitor and then find the muscle imbalance in evaluation of your conducting your program. And also you should know the goals and expectation. When your athlete, you want to return to competition, when you should going to return routine, you know, sport activity, and how many months you have, how many weeks you have, and then all you should know what is the goal that when you want to go into the selected proper program or technique. The other things that I should say that is program, when we designed some program for aquatic trophy is exactly similar to land-based program. There is a sequence, they have a warm-up and cool-down. They need a stretching, they need, and then they have a warm-up and cool-down, and the main body of exercise, like is it your purpose is strengthening, mobility activity, endurance, or, you know, improving cardiovascular fitness. It depends on that. Is when you design is mostly you should know the program is exactly similar to land-based. And we should follow the same discipline. And the other thing that you need to know is type of aquatic technique based on our facility and goal. Definitely we cannot find a similar facility in a all pool, all hospital. Maybe they have some, you know, their own service based on their what is this, the equipment and facility. But we can suggest in 3 categories. If exercise happen in a shallow pool, if the shallow pool, definitely you can do some exercise in a standing position, like a balance exercise, strengthening and resistance training. And you can do some walking for casual walking, sidewalk, marching, and then backward, forward walk, A lot of type of walking you can, apply inside the water in a shallow pool. It's interesting to know that if you're going to do in a shallow pool also, you can have in a 1.2 meter depth or 1.30 or 40 mostly, and mostly we can use 1.4 and 1.2. And then each level of depth of water has a different effect. As you can remember the previous slide, I explained about the immersion depth. That is how much we are feeling our weight inside water. For example, when I'm going to just walking in a SIS, is meaning that is we can do so much more resistance training. If we are going, for example, to be in a net, is meaning we are feeling that a less weight, and then is mostly is for assisted training. And then the other things is jogging and stretching, and then is also another thing that is cardiovascular activity and aerobic activity. That is many pool, they have a different step that they will use for the for the aerobic or cardio activities. And also there is some aqua games also is common, especially if you have some service for children that they had an injury or they have some problem. The other category is exercise in deep pool. Definitely walking, swimming, and aqua games. And we should know in this part, definitely many of your clients, they don't know swimming, they don't know how to floating, and then we need to use the deep water flotation equipment like a wuggle, like a luda, like some protective belt and buoyancy belt. Is meaning that there is variety of equipment that we will talk later. And also if you rehab purpose in hydrotrophy top, is mostly in a hospital we use it. It's like a walking, swimming, and aqua games, or stretching also simple activity in this hydrotrophy top. And in this slide you can see some resistant exercise in deep pool, because I think your imagination for shallow water is maybe everybody have some imagination, and then I just put this slide because maybe you need to know much more about how we do in a deep pool and then activity. And it's wondering if you know that resistance training is the best intervention strategy to improve fitness and health because of viscosity and buoyancy of water that I explained. Let's watch this. You can see they have a buoyancy belt and they are walking. Is meaning that they are easy and comfortable to be floating inside water. And then is reason that we need to use the buoyancy belt, because it's not, without the buoyancy is not easy to to walk inside the water and then or run or jog inside water. I think is if you, and then the other one is exactly same but it's different. See, is this exercise is much more for fitness of athlete that they want to mostly in a final phase of recovery or rehabilitation. Mostly this resistant exercise is for the final. Is if you're interested again, you see the buoyancy belt using here. Still they need to improve the activity, but here they have also some floating and then also some resistance in their feet and then their ankle and also in their head. It's too much professional for professional athletes or elite athletes. Okay. Now it's time to talking about the equipment for aquatropy. We have again different category of equipment. The first one is safety equipment, like clothing and attire, and then is the other things is some equipment for safe entry, safe exit is in this category. And some hygiene or any type of service that we need for our injured athlete, we should consider in this part. And the second one is assistive device, like help stabilize body and then maintain buoyancy and assist in a motion inside water. And the third one is resistive device, and used to increase muscle strength, endurance, and then increase surface area. It's required to speed and buoyancy or weight. It's meaning that is this equipment is designed or prepared based on your what is the level of your service or the purpose. And finally, cardiovascular equipment and devices that we can use in aquatic trophy. This slide shows some aquatic trophy equipment in a as I say, for safety purpose. And then you can see, for example, this athlete need to do some activity. Definitely, he had some maybe in a upper body or spine problem that is using this facility inside water to be in a safe position, and then they are going. And then the other is for carrying inside water or supporting inside water in a safe position. And any ladder, any facility to go safe entry and safe exit is equipment is we can consider in this category. And this is equipment for assistive devices. It will help like maintain buoyancy. It's like shoes, like a wuggle or noodle pool, or the correct name is wuggle. The float or kickboard or buoyancy belt that is we can use for assistive device. Also, this slide also another equipment for assistive. You can see how we can use wuggle or noodle, swimming noodle in a pool to support, to assist our client or injured athlete. Also here is also another assistive equipment you can see that is supporting our client. And also for resistive is this much more explanation about resistive device. That is, you can see some pedals, some water shoes, some web gloves, is meaning that is all the is here that you can see a lot of gloves and hydrophic cups and all. And every day when I'm going to some shops is related to do these services, we can find a new design of equipment. Maybe in future, inshallah, why not? You can design some, equipment for different level of aquatropy. As we know, in our faculty, we have some innovation, for example, for swimming by Mr. Atir. Maybe you can also some design and innovate some equipment for different purpose for the aquatropy. Nowadays, every time we can find a new equipments. Also, it maybe you are interested that we have these days we have some COVID gloves for the aqua activity. That is people coming to pool because not touching everywhere. That is just wearing the what is the aqua COVID gloves, and then they are coming inside water, and then when they are going to this, they just throw out because maybe they touch everywhere that is wet, and then maybe COVID viruses is there. My means is these days we have a variety of facility and equipment, but you should know in which purpose that you want and in which category you can use it. And this slide shows the aquatropy equipment for as a cardiovascular devices. As you can see, we have some treadmill underwater. We have some exercise with a simple way with a noodle. And then if you wanted to go to pool, you can practice in future, inshallah. It's just maybe 5 minutes. We need to practice and noodle in putting noodle, and then they are first find their balance. And then when feeling they're stable, they start to walking inside water. This is also hydrobuck or water bite, is meaning that is many developed aquatrophy center. They have this, and it's another also hydro bite or water bite, and is also some another treadmill that is monitor all of the condition of a client, that is heart rate and all. Is somehow like and when we talk about aquatrophy or aquatic facility, we have a lot of different pool, different design, different services. Is meaning that is how much the aquatic trophy center they have they design to have a service, or how much they are have a budget to develop. It's just in simple words I should say you see. If you can see in this, for example, the simple way to to the client going inside water, and then there is some step here, and then it started, definitely it will started from the shallow water, slowly coming to deep water. And then in any pool we have how much is depth, it should be clear that is the depth of also water. And this is also another appearance of the pool that you can see, for example. And don't imagine that is aquatrophy. It need to have for example, Olympic size pool like UPSI. No, UPSI is mostly purpose for swimming and sport, but definitely we can use it for the aquatic purpose also, especially in a small pool, and then shallow shallow pool, and then also in some part of the other pool. But when we're going to have a aquatrophy in a swimming pool, is a little difficult, because for injured people you need to have a proper service, hygiene, carrying, and then we don't have here. Maybe inshallah UPSI plan to have some aquatrophy center. They need just step by step. Each of these pool will be used for one client or one injured person, or maybe now the same time they can 1, 2, 3, 4, 5 they can use some activity and do some exercise or in the pool, and the same time they have the seat distance for the walking purpose, for jogging purpose, and definitely they continue in this part have what we say is a deep part also. And it's just appearance that you should. And also mostly recently with every activity they just monitor in a virtual screen, that is mostly they monitor all of the activity of their client or the injured person. And in this slide we should be familiar about the hydrotrophy facility. And I should say when you're going for hydrotrophy facility, is somehow in a hospital is difficult, because mostly the hospital is much more, trying to have they have a limited space, that is comparing to a sportive area. The sportive area, they have a lot of, spaces, but in a hospital, mostly there's limited because of availability, because of center. They are in a city center, or it's reason that is they don't have the same spaces for the hydrotrophy. It's meaning that is one of the what we say that is you can see in this slide is hydrotrophy top. Is meaning you can see just one person they can lay down and then it just have some services. Or this is some, for example, therapeutic showers here. And I not put some steam bath and sauna is meaning also common in Malaysia. We rarely use it because it's the temperature I think is enough if we have some services in this kind of facility. But many countries like four-season countries and like cold area countries, definitely they have a steam bath and sauna also. And this is, there is some multiple air and water jets in, you can see the shower, and additive might be used in enhanced to bath for aromatotrophy is meaning the sweet, and then mood and clay or herbs, and then is meaning sometimes they have some herbal steam that is using for the relaxation, and then also somehow sometimes they use a cool tissue, warm tissue, and then to stimulate the tissue. But it's mostly is under supervision of the hospital is happening. And also this is proper sanitation of bath is definitely is important when we have these services, because they need to have a bath services in this condition. And this is another picture that about the
Doctor.
Yes.
Sorry for interrupt. They have one question in the chat box, which is from Anitia Ani, which is the question is from her reader. Some terms are often used interchangeable by different peoples and also in different countries. For example, in US, hydrotherapy usually refer to the hospital-based physical therapy program for PT with wound or other acute injuries. In Europe and Australia, hydrotherapy is a term used to describe rehab exercise done in a heat pool. How do doctors find the aquatic exercise terms used in Malaysia?
Can we continue and then I answer later, or no?
Oh, can.
Yeah, if it's possible, we can. Yeah, interesting. Definitely, I will explain that. Is because we have what we say. We have a different terms that I mentioned at the first of the first slide, if you remember.
Oh, all right. You can answer later, Doctor.
Okay, sure. But maybe you will tell me again the exact, the answer, the question.
All right.
Okay. And this is also another hydrotrophy top that you can see in this picture. Interestingly, we have aquatrophy facilitate for horse also. Maybe interesting to know. Yes, we have, there is some services for horses, special for some horses that is so expensive, and then they injured, and then they find some problem, and then yes, we have these services is also some for this purpose as at least for horses. I'm sure for the other animal I'm not sure what is for horse. Yeah, there is some services when they wanted to recover very fast, because horse is also some part of our sport. Is meaning that is for is for a sport purpose. Maybe one reason that we have aquatrophy for horses for is some part of sport, is meaning that is maybe for the other animal we don't have this purpose for a sport. And I think it's good to know that is another purpose of aquatrophy is a mental aspects of aquatic trophy, and for relaxation and feeling weightless, and preserve rate of exertion is less, and then less fear of falling or injuring self in the water. And but mostly when we have provided some aquatic service, we also at the recovery, in cool down session is maybe 5 to 10 minutes. We provide some also aquatic therapy for as a mental relaxation. It's also common mostly in a one session of aquatic therapy. And we talk a lot about the benefit, the goals, and then how much is effective, that is how much is useful for aquatic therapy useful. But is it useful for all people? Can we use for every group of people or no? It's reason that is very important to know about percussion and contraindication for aquatrophy or any aquatic exercise also. First, people who have a water phobia. Yes, we know that is important for them, is so beneficial, 100% beneficial, but they have water phobia. Again, we wanted to add some stress to their life, is meaning that we cannot to suggest them. It's the first step when you wanted to checking, that is to provide some service. We should know if people, they have a water phobia. And the other is neurologic disorders. And for water phobia, I should mention sometime, I have some experience that is, sometime one session we try for them slowly, but they release their thing, but some of them totally have a really, water phobia or bad experience, and then they never accept also to try one session. And the second one, neurological disorders, is definitely we cannot to suggest for them. And uncontrolled seizures is meaning that is we should be careful. And then cardiac or respiratory dysfunction is very important that we should know about the our background of, for example, people. And is meaning all infection. Is mostly for athlete for rehab. That athlete who injured, some part of this is more effective, but I'm just putting in general. For example, if our athlete have a water phobia, if our athlete have an open wound or skin or viruses or anything, and kidney disease for as a general, or some of our injured athlete have a chlorine or bromine allergy. And people who have epilepsy, aspiration, uncontrolled bladder, or danger of bleeding, and contagious skin rash and unstable blood pressure. But mostly for our injured athlete, we should check the water phobia, we should check for infection and open wounds, and we can check for chlorine or brome allergy, or danger of bleeding, because the other things is meaning that is mostly our injured athletes, they don't have any the other background. Mostly they are professional and healthy athletes that they found some injury. And finally, nowadays I should mention about COVID-19 viruses. Definitely we cannot suggest for this time, that is reason that now we just going to improve our knowledge in a virtual way. And then I should mention also is not suggestible in this time. And then the rest of my slide is about aquatic trophy progression. Definitely when we start aquatic trophy, we have which phases of rehab we are wanted to using. Early, in a mid, in advanced, or in end phases of rehab. We should consider each phases. Definitely for early phases, we use buoyancy equipment to increase range of motion. The first step maybe is like the other, sport rehabilitation services. The first step we should improve range of motion for our athlete, injured athlete. And then the other is trying to gate training in a deep water. Maybe in a shallow water is they cannot to put their foot in the pool, but in a deep water is the best time to start to improve their game, because some of them they cannot walk, and then they started to walking. And then use a low level of restriction exercise without equipment in the first phases or early phases. And then in a mid phase, we emphasize to restoration of muscle strength and endurance. We start to improve muscle strength and endurance in this level. And then we used to drag or increase resistance with some equipment. And also we add some resistive equipment like wiggle, like floating. And then also in these phases, we try to starting repetition and set of exercise that we conduct. In advanced phase, and we should focus on the restoration of proprioception sense. And then it's again gait training, but more intense, in a more intense level. And then maybe in this level, we just add a gait training in a forward, in a backward, in a sidewalk, is meaning that is we should, or marching is meaning that is in this phases this happen. And little by little, in this phase, we should go in hopping, jumping, and any activity like this, hopping and jumping. And also in this phase, we can giving them in open eyes and closed eyes also. And the other things is we can increase the intensity of strength training in these phases. At the end phases, we should mimicking skill and demand of sport. What is our demand of the sport? Is meaning that is for swimmer, for hockey player, for basketball player. We should organize and then arrange the plan exact program for the skills that our sporting needs.
Dr. Fariba?
Yes?
I'm sorry to interrupt, but Dr. Zulizwan have a question to ask to you.
Yeah, sure. And then you wanted to leading me, us maybe. Okay, sure, I'm ready.
Hi, Dr. Fariba.
Hi, dear. Thank you for joining us.
Salam Ramadan.
Selamat Ramazan. Ramazan Kareem.
Kareem, yeah. Yeah, Doctor, I have a question. I just want to ask. I just wondering when your previous slide for the precaution and contraindication, isn't it?
Yes.
You state that about the HIV, something like that.
Yep.
So, what is that supposed to mean? Here you state here all infection and open wounds, skin viruses, HIV, hepatitis A, something like that. So, what do you mean by that? I mean, for those who have those thing cannot join in the same pool with the.
It's meaning that if you provide some, a specific pool for them.
Okay.
Yeah, it is mean that it definitely if we have for example, private service for them, we can do. But as a general, if we should consider that is all infection we cannot do give service. But the other things is, Dr. Zol, if some people they have this problem, it's not easy to change the volume of all the amount of water in tubs or in a pool that for next person is meaning that is completely we never permit to have.
But as far as I'm concerned, that HIV, it's transmitted through blood, isn't it?
Yeah, but it's mostly they never per minute. Is meaning that is, I know that is a standard, that is, I just remember that is we should follow the standard by Aquatropy services, that is we go to the, you know, the, is some standard level that no, we cannot accept.
So it can transmit through water?
I don't know, but I think maybe. But mostly maybe we don't know about it. Maybe we don't know about it.
Just precaution, isn't it?
Yeah, just precaution, because this problem is maybe.
But there is no double standard for those like have, let's say, a woman, you know, get HIV through her husband. It's not her fault.
Definitely.
we want to like.
Yeah, I know. It's because you know the infection rate.
You cannot join us in the pool here because you have HIV.
Yeah, because it's a transfer by the water. That definitely is there's not the way. Yeah, it's not transmitted by water. I know, but it's mostly is precautions. That is all standard that follow up. I just remember when they had, you know, the courses by in my country, and then the others is they mention is also Dr. Zo is in a pool also. If we know we have for swimming service also we just follow it. Even though we don't know, many times we don't know. It's some challenging question. Yeah.
Okay, yeah.
But at least I can hear from you. Thank you.
Okay, thank you.
Can I continue?
Hope others can understand. Yeah. Transmit like through water. Don't discriminate those people. But somehow, what I think, what mentioned by Dr. Faribah is just a precaution. Yeah, it's better.
Yes, it's exactly precaution. And then the other things is mostly they never say it or we don't know, but we should consider this as a precaution.
But
can I continue, Doctor?
Okay, yes, please. Thank you very much, Dr.
No, most welcome. So nice to hear from you. Thank you for elaborating some, interesting question here. Thank you.
Thank you.
Okay, we were in the end phase of aquatropy progression. Is meaning that is we should know what is the purpose of our athlete sport, and then what is the demand of a sport that we need for our athlete. And then definitely we need to aggressive coordination, agility, and speed of activity. And also in these phases, we can add some plyometric exercise. And okay, there is also some disadvantages for when we access to when we talk about aquatropy or aquatic exercise for rehabilitation purpose. The first thing is not easy to access to pool, or many hospitals they don't have these services, and not every clinic is have this suitable for aquatic trophy. Is meaning that is sometimes they have only one hydrotrophic top that's one or two, and this is expensive service if you're going for private clinic or services. And also the other is qualified pool attendant, and then finally qualified professional athletic trainers. Is meaning that is at least in this part we have a few people that they are professional to provide this training. And then interesting if in this part you have we talk about in this who is qualified, who can can have these services in a question and answer. Is reason that I'm not considering this slide, but I'm here if you want to know much more about the professional athletic trainers in aquatic trophy. And this is one example that is going to talk about when we talk about the rehabilitation for upper body injuries. It's just some recommendation for the treatment that we can use aquatic trophy for the shoulder that have a complex injuries, for injured elbow and wrist and hands in our upper body part. And again, we should have an initial level. That is, in this level, we start our patient in a shoulder deep water. Is meaning that is definitely our shoulder should be immersion inside water, in deep water, or maybe sometimes it's not easy to sitting inside water if the depth of water is low, and then it's better to find some assisting to floating and then inside water. And then the other is walking forward and backward, trying to keep a normal arm swing. Is meaning that is in this state also we need to some supportive and assistive for floating. And also glandular humeral movement can be done in with a client that is against the wall or to establish scapula. And also the movement can be done in supine and prone depending position, and then is the level of that how much they are comfortable. There's something that we should consider is that all of the client or the injured athlete that is coming, they should be comfortable. It's the first step that we monitor in the when we find when we have some services. An intermediate level is at this stage we can use equipment to increase resistance, to build and strength. Is this level we add some resistive equipment? The best one is what we say kickboard and floating. That's available everywhere. And also keeping with the pain-free zone. Is in this level also our injured person or client should not feeling that is have a pain inside water. Is meaning that is very good point to add more, intensity or more different exercise. And also scapular stabilization, it will be suggested in this in a supine position. That is the easy to do the activity in this level in supine position, and also overhead movement can be incorporated in program by positing the patient in a supine or prone position in both. And finally, in a final level of this mostly is happened in a week 6 and week 8 of our program that we provide. The goal of this level is mostly for a sport-specific movement. If, for example, is a which sport that they are involved, and also we provide some exercise to have a more challenge related to their specific sport. And by bringing a sport equipment to the pool, and then it will be can do. For example, for basketball player, they also provided one basket in front of the pool, and then the athlete maybe is just start to trying to to do shooting in a what we say in a basket, and then little by little getting prepared for the the real practice. And the next is about the rehabilitation exercise for lower limb injury. Is again for hip, knee, or ankle, we can have some treatment. And in initial level, we should increase the normal movement, and then also again strengthen the range of motion is very important in this step. And then is walking forward, backward, sideways is help to be to normal gait, because mostly when we have an injury in the lower limb, we find some problem in our normal gait, and then we are not comfortable to walk. It's the reason that is this stage we start to getting back to normal gait. And then also deep water activity, it will help to cardio, improving cardiovascular, and then is meaning that is to stress if they have some stress fraction. And then if special people who cannot be weight bearing because of stress fraction, if they cannot to tolerate with their weight, is meaning that is have some bone fracture, is meaning this we should start in this level in a deep water. And the intermediate level, again, we should increase range of motion, strength and flexibility, and then they can use some aqua belt, and then it can go to the running inside the deep water. In this level, we start a little by little to run, our athletes run and start running inside pool. And also can do eccentric activity in shallow water by standing on flutter board or noodle, or another name is woggle. And finally, in final level, the best use as a complement to land training, it will be going to shift it to land training. Can use to deep water activity without flotation belt, and then independently without any assist aid, and then can do a squat or noodle or dumbbells or flutter boards, and then also easily running inside pool in a deep and then shallow level. And this is one exercise program that we did in UPSI for improving knee rehabilitation of knee, and then for strength and stability of injured athlete. You can see is this training protocol. We should consider intensity, we should consider frequency and time. Mostly we consider for athlete people twice a week. Mostly we consider twice a week. And then for all the program that we provide. And then is meaning that is as you can see, is a knee is lower body. We can consider water walking, forward lunge, or one leg balance, and then all is, you can see. And also we consider, definitely we need to consider a warm up and cool down in any program. I will share this if some student interested to, for example, follow up in their final year project, or in future they wanted to work. I will share. Meanwhile, the article is available if you want. And this is Aquatropic website. Is some organization in the world that you can see this all area in a website that is maybe is every day maybe develop another association. What is much more common is this. And then the other things that is asking about Malaysia. In Malaysia, we have some in what is the Sukan Negara, Malaysia. We have a very good facilities, and also we have a Malaysia Aquatic Trophy and Rehabilitation Institute. They have some website, but this institute started 2018. It's based on my knowledge that I have in Malaysia. There is a good potential if you're interested to develop this area in Malaysia, and I think you can develop easily. And just you need to some criteria that you have to able to, for example, to water activity, or if you know swimming, if you are at least you should know the basic aquatic skills inside water, and if you know this, is the best time to go and then develop this area in Malaysia. And we need it because of definitely after COVID we need a lot of trophy, and then the aquatic trophy or aquatic exercise is one of the best for rehabilitation of people, not only for athletes. You can also provide some services for the ordinary people that have a lot of tension, anxiety, stress during these 2 years. I don't know how long it will be this. And then it's time, if you thinking and interesting to develop. It is my knowledge about Malaysia, but I know that is what's the Sukan Negara Institute. They have good facilities. Some hospital they have limited services, and this Malaysian Aquatic Trophy and Rehabilitation Institute they have. Also the Aquatropic Academy also some provide some services. Is the thing that I know about Malaysia, or maybe my information is not too too much, but is there recently, just I know from 2018 this institute. As a conclusion, I should tell that the aquatic trophy is also uses the physical properties of water. Should be exclusive treatment and option for athlete. Many physical and psychological benefits happen during early stage of rehabilitation. And sport-specific training utilize land and water-based training for their achieving their goals. And then must be sure to engage in activity in a normal speed and force level prior and to return to play for our athlete. This is some picture of hot spring in Ipoh in Malaysia, close to us here. And then this is also UPSI swimming pool spectacle, and then we can, but now we don't have, we have limited service there. This is references, and then I'm here if any person have a question. Really appreciate for all people that is joined to this webinar. I hope that you find useful, and then I hope that is you catch some at least basic knowledge and information about aquatropy. I'm here and also in UPSI mostly available for all of the students, especially in rehab students, to help them in this area if I can. Thank you also, Arif, for moderator, and then for all of the MC student that is provided very, good time in this webinar.
Okay, thank you, Dr. Fariba, for sharing the interesting knowledge with us. So as we mentioned earlier, we do have a Q&A session with Dr. Fariba after the talk. And we have collected a few questions from the participants in Facebook Live and also from the Google Meet. So are you ready, Dr. Fariba, to answer the questions?
Sure. I'm here for you guys, yeah.
Okay, now I'm going to read the question. So the first question is from Celine. He asks, is it suitable to train gait for stroke patient using aquatic therapy?
Definitely, yes. I was not, I just mostly concentrate for aquatic exercise or aquatic therapy for the athlete, injured athlete, because it's our area and it's mostly my our student listening me, and then it's for sports rehabilitation purpose. But definitely one of the best way to to have a faster recovery after stroke or any surgery of heart injury is walking inside the water. Yes.
Okay, Dr. Fariba, thank you for answering the question. So the next question is also from Mr. Muhammad Amin. So is it okay for people with heart problems such as hypertension to join aquatic therapy? And if yes, does we have to monitor the patient blood pressure during the session?
Okay. If you remember the slide that I talked about percussions, it's meaning that is if some people they have hypertension or high blood pressure, we should be much more accurate. And then honestly, I should answer that is if we have this kind of client, it's they should monitor very well. But mostly, if it's depend on how much their hypertension is, what is this it fluctuated or is not unstable. And it's reason that is we can provide these services, but we should consider the temperature of water, the depth of water, and who can give the service for that person. Is meaning that mostly they need too much professional person, and then under the medical team that is monitor every stages. But yes, we can have also we can have, for example, for some people that is aspiration or sensitive, but we should be somehow we should be monitor them very well. But the most things that we should consider the who giving the person the aquatic trophies, and then the other is we should consider the facility and the temperature of water, and also sometimes the what we say, the percentage of the chlorine and bromine of water also they affect to their maybe their breathing or something. Yes, we should have a specific service for them, but we can. Any more questions?
Yes, doctor. The next question is from Atika. From her readers, there are some terms are often used to interchangeables by different peoples and in also a different country. Hydrotherapy usually refer to the hospital, thus physical therapy program for PT with wound or other acute injury. In Europa and Australia, hydrotherapy is a term used to describe rehab exercise done in a heat pool. So how do doctors find this aquatic exercise term used in Malaysia?
Okay. I think it's not only for Malaysia, if I'm going to say, because, you know, when we're doing some medication or some, you know, medical service or also some sport is mostly is an international service. Definitely we need to have some localization for any service if we have some, you know, in different countries. But we cannot broken the standard level. But as I'm working from 2009 in this area from my country and here also, and then I did a lot of research, is yes, in a hospital mostly they have a facility in a, with a much more in a warm water temperature. But in the case that you mentioned, that is in Malaysia, Malaysia also should follow, I think, the standard of the services, but is for aquatic exercise, we are much more, you know, what we say is the much more services available, because mostly for aquatic exercise, people coming for the fitness purpose or prevention purpose or some, you know, the relaxation or losing weight is much more variety of service, and maybe many of the people with the business purpose, they provide different service. But if we're going exactly for therapeutic purpose, that is happen under the medical team and then under the supervision of the hospital standard, is meaning that is Malaysia also follow up the other, like the other countries, the other, you know, standard that is available.
All right, doctor. Thank you.
I know that is Malaysia is also is follow up the standard is very well if they are going to at least as I know they never broken some rules for this, but in the hospital area, as I know, I don't know, maybe local people know better, or maybe I never be much more, you know, as a what we say, as a patient in the service, but I know that is never broken the standard that is available and is recommended in the world.
Okay, doctor. For the next questions is from Atika also.
Again, Atika.
Yeah. Does aquatic therapy, aquatic exercise, pool therapy, water therapy, and hydrotherapy have the same meaning or different purpose in term?
Okay, Atika, when you joined to our session, because we already have one slide, do you remember, Penny? Yeah, I can share my slide if you want to know. That is the different, we already talked about the different, yeah. Do you remember that we already talked about the first slide, because we started by term of, sorry.
Maybe I joined a bit late, maybe about 15 minutes.
Okay, Atika, no mind. Hydrotrophy is mostly the eldest therapeutic method for managing physical dysfunction, and is mostly applied in at the hospital services and facility. And water therapy is mostly really used for the effect on body tissue, on heating, cooling, detoxing, and then pain relief. And through the the drinking water. And aquatic therapy is included any exercise or manual therapy or physical therapy inside water. It's, I think, the simple way that I can say that is happen in an aquatic environment. Mostly we use in a pool, mostly in a sport rehabilitation, mostly for sportive people. We mentioned that is aquatic therapy. That is much more, you know, service provided for us. But definitely there is some overlap in practice and then in the principle between us.
Doctor, I would like to ask your opinion. Doctor?
Okay.
Yes,
sure.
Does this Aquatropic suitable also for adolescent athletes?
Yes, it's very good for, you know, adolescents, athlete, and then also I think I should tell you so simple answer to you. Mostly athletes know swimming. Mostly athlete people, they know, for example, one racket game, one ball game, one aquatic activity. If they know, is meaning that is, I know many athletes that is after 70 something, just they can continue some simple activity in water and then just go to have some activity, walking, and then some aerobic activity, or relaxation, for relaxation also going. And also is, you know, when we getting older, is meaning that is our sport performance, it will be limited because of aging. But the best way is exercise inside water, because of there isn't any, you know, stress in our joint, you know, or we are unbearing, you know, our weight, is meaning that is yes for all the, you know, what we say, the elder sporty people. Most of them, they are going to swim in a elder age. Yeah, interesting. Yeah, then if you are a sporty, you should learn for, you know, and then plan for your future.
Okay, thank you, Doctor.
Welcome, Atika. Thank you for joining us.
Yeah, good sharing. Thank you, Doctor.
Thank you. I hope that
I'm really interested in this aquatic therapy and hydrotrophy. Maybe I will do some research in future about more in hydrotrophy.
Honestly, if you're asking me, I really wanted to request you thinking and motivate to develop in Malaysia. It also, I'm sure that is, I'm not talking about the business part because I don't know exactly, I'm not expert on that one, but I know you can provide very simple services, especially in Malaysia. We have a good away, you know, a good, let's say the pool, and then the, at least is aquatic environment is much more available to comparing to the other countries.
Okay. Okay, see you.
Welcome. Maybe our sport club.
Thank you.
Any more question? Arif? Arif, as a swimmer, you can motivate to develop more and more these services.
Yes, Doctor, we have some more questions.
Okay. I find some question in here in not in Malay, is meaning that is Dr. Zol, different temperature. Okay.
Can we move to the next question, Doctor?
Thank you, Dr. Zol, is one that helping me in the answer of the chat box.
No worries.
Okay, so the next question is, can aquatic therapy be done at home, or is there any aquatic therapy method that can be done at home?
If you have a good facility, why not? But a good facility and also some good supervision to do, why not? Many, you know, luxury houses, they have their own gym, their own sauna, their own pool. They can, but it's that definitely they need to have a good supervision and then enough expertise to do. But mostly, if you do some, for example, you wanted to improve some flexibility or some strength, improve strength at home, and by your own, you know, training, and then you are not professional, the injury is much more than the exercise that you do by yourself in water. I'm just talking about the similar situation. We have one person that is not expert in you know sport rehabilitation to do by for their self and then in a land or water. If you are not expert, is the injury and then what is the risk inside the water is less than that, at least.
Okay, so the next question is it possible if half the patient body is paralyzed to undergo an aquatic therapy treatment?
Sorry, again?
Is it possible if half of the patient body is paralyzed to undergo an aquatic therapy treatment?
Is meaning that is only half of the body? Yes. Mostly we have some special hydrotrophy top that is they put only, for example, their arm or for lower limb mostly. But as we cannot to separate the psychological effect and physiological effect during the rehabilitation, mostly the immersion of our body is until neck or xiphoid level. But we can, yes, we can, and then we have some services. Especially if they want to, for example, you have an ankle injury or knee injury, an ACL injury, that's just, you start with some, extension, flexion, abduction, injection, and also plantar flexion, dorsiflexion, inversion inside water, and then we added some, strength weighting. Yes, we can do it.
Okay, thank you, doctor. So the next question is, if someone has a traumatic experience in deep water, such as pool, but she or he needs the aquatic treatment, so how do we handle it?
Okay, it means that they have a water phobia?
Yes, doctor.
If they have a water phobia, I'm just sharing my experience and then my knowledge that I have. If some people, they have a water phobia, I suggest them one session to try. And then just we should be support he or she is too much to be comfortable inside water and trust the water. Because sometimes the water phobia is meaning that is too much, we have a too much bad experience behind, or sometimes it's just mental and then we can release it in one session enjoying inside water. It's reason that I suggest one session at least try. But if some people totally have a water phobia, we never persist to do it because it's some psycho problem. It's a psycho effect. We cannot what we say, provide this limited program to have, for example, 6 weeks, 4 weeks, 8 weeks to first release the water phobia. Water phobia sometimes need 5 sessions, 6 sessions. If some people coming to learn swimming and then they have sometimes it depends on the person, but mostly it's too much challenging. If some people that's water phobia and then they never interested to coming, we cannot force them. But if they're interested, one session we could try that. If we monitor how is the process of the behavior, and then the water phobia is go ahead.
Okay, thank you, Dr. Fariba. I think that is all the questions for today, and we would like to thank all the participants who asked the question, and also thank you to Dr. Fariba for answering all the questions.
I'm also grateful that if I can help my student and also any person that participate in this webinar, and really thank you, because I know you are fasting and spending time here to listening me. I hope that you find useful, and then my question was, clear for your, my answer was clear for your question. Thank you so much for all lecturer, Dr. Mohan Sundar, and then Dr. Zol, and then I don't know who is in our lecturer, just join us, all students, and also Arab, Siti Nur Fatima, Tini, and all of you that maybe and also thanks for the Sports Rehabilitation Club of UPSI for organizing this.
All right, thank you, Doctor. Okay, before we end our program today, let's welcome the President of the Rehab Club, Mr. Arif bin Aminuddin, to deliver a speech as token of appreciation for the guests, honor lecturer and student who are willing to spare their time to attend today's program. Please welcome.
Okay, Assalamualaikum and good afternoon. Thank to our MC, Yang Berusaha Mr. Mohan Sundar Sangkarabel, Advisor of Sport Rehab Club, Dr. Fariba, as a speaker for our program today, Aquatic Therapy in Sport Rehabilitation, Dr. Zul Izwan, all the lecturers, students, our alumni, and audience. Okay, Alhamdulillah, thank you to Allah for giving us opportunity to meet all together on this webinar program that have been organized by Sport Rehab Club of University Pendidikan Sultan Idris. First of all, I would like to thank everyone who present and spending time together today. This program could not have been possible without the support of all. Thanks you once again. For respected audience, this is my great hope that this planned program can achieve its objective, which is to share the knowledge of aquatic therapy in sport rehabilitation. I, as the representative of management, hope that this program can benefit all attendants, and hopefully this program can further strengthen our relationship with each other. Finally, I would like to thank to all the guests and attendants who spent their time for this program. Thank you.
Thank you, Mr. Arif Aminuddin, for this speech. Next, I would like to remind all students to scan the QR code as proof of attendance. My charm or my cat will be given to the student who fills in the attendance form. E-certificate will also be sent through the email. So make sure all of you scan the QR code and fill your information properly. I will give you 3 minutes to fill in the Google form.
Ladies and gentlemen, before we end our program today, let's take a group photo. To all the attendees, please turn on your camera and mute the mic. So the committee in charge will be taking 3 photos with count of 1, 2, 3 for each photo. For the formal photo, 1, 2, 3. Second photo, starfish. 1, 2, 3. Okay, last photo. 1, 2, 3.
It's time for Dr. Zol.
Okay, ladies and gentlemen, with the end of photo station just now, and so the end of our webinar for today. Before we finally leave this program, I am presenting the committee members of Threat Clubs in 2020-2021. Send my heartiest thanks to everyone who are present today. Till we meet again, thank you.
Tak mandi lagi, tak boleh buka gambar. Dr. Mohan.
Yeah, Dr. Mohan is, good
to see you.
This webinar.
Okay, thank you, Dr. Fariba.
Most welcome. Any comment from the
No, Doctor, I don't have any comment.
Tanya Dr. Mohan.
Anyway, at least we can see, my student from last semester that now missing all of you.
Yeah, yang di student yang batch Nasirah tu sekejap je. I mean, just 1 or 2 weeks only, is it?
Yeah, because Dr. Zol, we don't know the other newest student. At least we know.
Why? It's very hard, when online. I don't know whether I can recognize them.
Definitely. Now I know who is Fauzan, who is Arif, who is Steve, who is Fatima, who is Jira. Yes.
Yeah, this batch I sempatlah maki sekejap seminggu 2 tu, mana yang degil-degil tu. Who stubborn, I managed to I don't know siapa yang kena dulu tu.
Khairul Anwar, all of you. Just Raichai, London, and at least I know my student. I have some sense to them. Is meaning that is Dr. Zol. Is sometimes I have some 60 students and then I don't know any student. As for me, it's my habit to know my student is some difficult.
Yes. And usually, now they tend to not to on the camera during the online.
Yes.
So the first batch that I teach this semester, it's hard for me to know which one is which,
Yeah, and then we cannot force them. That is because they told me that is we have a poor line.
I have to. You need to force them to on the camera, Otherwise, they just, join the
and then leave.
And then they
but
when or whatsoever, I don't know.
But sometimes when they turn on the camera, they poor line and then they totally leave. Or I don't know, is it a trick or is it the real one? I don't know exactly.
they just put yeah, I know that.
Yeah, we should write a book about teaching during COVID.
There are many tricks.
Many tricks. And I know some of my student trick because of my niece is a student in university and then she shared with me a lot of experience with me.
How to trick the
lecturer. Yes.
Usually I will ask question, everybody I will ask, and if there is no answer, but you know what, they will use the excuse, the line slow, doctor, I cannot hear you. That is when the line slow or the Wi-Fi interrupting, something like that. When we ask question, the problem is there.
Yeah, doctors though sometimes their sister or brother or friend is there. Okay, if they call Faribor, just tell me to come in to answer. And then many trick of the, new generation, as you know, the generation of visual life, and maybe they are better than us.
But they forgot that we live longer,
Yes, they this. But anyway, I know that is how much is my student is suffering from this situation.
Yes,
we understand.
My class is sad, or they cannot experience all those running activities. But somehow, like Nashraf, maybe she like the online things.
Yes, but I totally disagree, Doctor. I'm totally disagree with this. At least when I'm teaching swimming, for example, courses, is meaning that they put in a cage and then they tell me to fly. Is meaning that I should do same with my student, but we don't have any chance. I hope that is this holy month at least spark much more, health and then free of COVID. I hope.
Dr. Mohan.
Okay.
Dr. Mohan is not.
Thank you, Dr. Fariba. Thank you, Dr. Fariba, for your presentation. Thanks, Dr. Zul, for your time.
Yeah.
Good to hear from you.
Yeah, sir, because my internet was like on and off. Sometimes it's on, sometimes it's off. Very fluctuating, very frustrating also.
So this coming convocation, you will join the convo? Mr.
Hopefully, sir, hopefully.
Good.
When is it? When is it?
Doctor in the house.
Is it virtual convo?
This coming, I think so.
Okay, everything is. And then recently I read the news that is, the all museum, they just plan some, application. If you, for example, like to have a Mona Lisa, picture, they can they just register and then pay to the app, and then they send you to your home wall. And then after 1 month, you wanted to have another, from Da Vinci, and then again, and then delete it, and then another.
Oh, man.
Oh my God. And all is going to, and also another application is meaning that you wanted to present it, no need to go, makeup and then hairdresser or something. Just the application do all for you, and then just come and say. Oh my God, new, like really new things in our life. And I don't know another thing, but it's interesting. Oh my God, the media provide some services.
Expect the unexpected.
And then maybe Dr. Mohan going to for virtual convocation. But anyway, after COVID, we should celebrate, Dr. Zo.
Yeah. I think Mr. Mohan left already, but we celebrate the new doctors, yeah?
Yeah, new doctor, New and then old doctor. Okay. Dr. Zol, nice to see you. And then it's long time we are not see all of our students and also you. And I think if a student are in Tajumalim, I can invite them for the one iftar here. Who is in Tajumalim? Also, Dr. Zul and wife, his beloved wife also can join us.
Yeah. Just let me know the date earlier.
I am free any iftar. And then I don't have any husband, any children. Anyway, who is in Tajumalim? Student.
Rachel Owen, I think there.
Not in Tajumalim. So far.
Hakimi, the others? Okay, I'm really, it will be my pleasure if you wanted to, if start coming to my place and if you are in Tajumalim also. But you should promise to bring Dr. Zol and his wife.
Yeah.
Okay, thank you, Dr. Faiba, and thank you, Dr. Faiba and Dr. Zul. I think that is all for today. Thank you guys for joining. Everyone may leave the Google Meet right now. The certificate will be sent through email. See you next time. Thank
Okay,
you.
bye. Thank you, bye.
Okay. Selamat petang selamat tengah hari semua. Kita tangguh postmortem kita boleh ke? Petang ke malam ke esok ke? Boleh tak? Sebab aku ada agent lah. Boleh, tak ada masalah. Okay. Tapi sebelum tu nak cakap terima kasih kepada semua daripada apa yang korang bagi hari ni. Rasanya apa nak cakap, berjalan lancar tak? Semuanya berjalan lancar. Lagi apa semua sempurna lah. Okay, tak nak cakap, itu je kot. Cakap dah sikit apa-apa 2-3 sebelum kita habiskan benda ni, Nash.
MC power, mantap.
Thank you MC sebab dapat menjalankan tugas anda dengan sangat cemerlang walaupun ada gangguan-gangguan kecil sedikit. Thank you juga Presiden sebab paling banyak berkorban untuk event kita. And all the AJK yang kita malam lepas waktu patut memoreh tapi kita rehearsal semua. So congrats everyone. Mungkin kita boleh improve lagi pada hebahan sebab ramai orang luar yang berminat juga. Macam Danish dia ada kawan dia, saya pun ada kawan saya juga yang join, and also other students yang bukan alumni kita pun ada join juga. So I think it's a very interesting, kita boleh apa yang kita buat hari ni boleh jadi kata batu bercantat untuk next program. I think I can see another clear future in front of us. Okay, thank you everyone.
Okay, So kita postpone program apa kita punya postmortem ni kepada malam ni ataupun esok lah. Okay kita akan nanti aku up dalam group macam mana ramai yang free bila. Okay thank you semua. Terima kasih terima kasih. Alright, thank you. Bye bye.
Thank you. Bye bye.
Thank you.
Postmortem tulis siap-siap ya, nanti tinggal bacakan je ya. Terima kasih.
Sana. Jangan layan dia, biar dia.
Kau memang dengki aku.
Ni. Ada tak? Jangan cakap tinggal.
Aziz bolehlah kick semua orang.
Jangan kick aku.
Kick je semua orang.
Jangan. Baik korang.